All right, I've got them now. When I asked a couple weeks ago, Art, who are your favorite guests, a lot of people said you, which was amazing because you're not here that often. I mean, some people join almost every week, usually maybe once a month, and yet still people love you. So congratulations. You're one of the all-time favorites here on the show.
Thanks, Dad.
Your dad is such a...
No, my dad's actually dead, but
Well,
point being.
Speaking of mediums, are they ethical? These people...
Actually, I like the show. It's fun. And a little bit, I think some people may, enjoy hearing me because I have a little more time with you and a little bit more of me gets to show on the podcast than, say, the doldrums of CNN where Wolf is kind of doing his 20-second dour or something or other. Isn't the world going to end? It's a little harder.
Well, yeah. I mean, in your field, you need some time to have some nuance, some details, so we can understand why you are believing and teaching what you are. So let's get into that. Lots to talk about, as always, with you. Always excited to have you. First of all, let's talk about the ethics around boosters. I guess my question is, why are we giving a third shot to some humans when other humans haven't gotten their first shot in other countries? That seems like a pretty obvious first one to start with on the ethics of boosters, sir.
Let me get that off the table, gone right away. Booster shots. The boosters, quote unquote, the shots, are probably in 120 warehouses from Hawaii to Maine to the Florida Keys. It's not like they're all sitting in the CVS down the street from Pete. They're all over the place. They all are ticking in terms of expiration date. If we were going to send them to another country, we'd have to get trucks with special refrigeration, drive them well to someplace, put them on a special plane, and let me add, hopefully send them to a country that had a road and a refrigerator, which most likely they don't. It's not practical to round up those shots. It's a silly... I know WHO says it. Every once in a while, the guy who leads it gets on and guilts us all and says, you guys are having dessert and we haven't had a meal. And I keep saying, buddy, the real world is here that ethically, yeah, you got a point. It would be nice to get everybody vaccinated, at least minimally. In the real world, that's not how vaccines are distributed. That's not how they are spread out all over the country. You can't do it.
What about, let's say, from the patient point of view, you're 65 years old and you don't have you're otherwise healthy. You're just 65. You're in pretty good shape. And they're saying, no, you can't have your booster shot. And so you just say, well, I haven't had my first shot yet. And then you get a booster because my mom just told me a friend of hers did that.
Yeah.
And I was like, yeah, whatever.
So they have opened the door now to people, I think, over 68 or something to get boosters. Anyway, I went down to local Ridgefield, Connecticut chain drugstore, and I got my booster. Standing in front of me was a svelte 35-year-old woman who, if she had any illnesses, they weren't obvious to me, and she got a third shot too. I wouldn't say they were exactly policing the line down at the old Walgreens CVS, nor do I really expect them to, right? I mean, I don't know about your drugstore. My drugstore is falling apart. They can barely fill the prescriptions. They got nobody working there. The people they got working there don't want to be working there. I look at the pharmacist and I think this woman's going to be burnt out in 2 more days. She's going out of her marbles here. So the idea that they're going to sit there and say, Art, could you show me ID? Are you really in the elite? They don't do that. And to just show you what a man I am, I got my flu shot the same day. Same time.
Oh, wow.
One in each arm.
Wow.
How's that for
You love being double teamed by syringes.
Exactly.
Yeah.
And, I'm no weenie. I don't want to hear about these firemen who can't take a vaccine. Come on.
Well, let's talk about those who aren't getting vaccinated, who should be.
But wait, one more thing I want to finish. So,
yeah,
on the booster thing. The way we got these vaccines approved, remember it was emergency use and we all tried to rush the things out. So Pfizer sent data in, Moderna did. The data was based on a 2-week separation between first and second shot. What we were trying to do at the time was stop people from dying. We had Trump running around unmasked and not quarantining, and people were keeling over all over the place. They made the right call. They said, this thing works when it's 2 weeks apart. But the fact is, it's a 3-shot vaccine. It's not a booster. What's happening is normally you run vaccines for 3 shots and you find out that's how you get immunity for 2 years, 3 years. HPV vaccine for cervical cancer. Your family may start to be thinking about that. Or
I got the girls. When they were like 7 and 8, I could see the writing on the wall, sir.
So there you go. So 3 shots there. Hep B, 3 shots. Polio,
I was joking, by the way, folks. They were like 11 or 12. Sorry, I had to. Sorry, go ahead.
Right. And I'm sure you were scaring them out of their minds, but that's all right. You know what's going to happen to you.
Not even. They didn't even know. I brought them. They had no idea what it was. Here, get this shot. They might as well thought it was the mumps, but yeah.
Polio's 4. You don't remember this because it's done as a kid. And I'm here to say COVID vaccines, Pfizer and Moderna are 3. So the reason I'm ranting about this is it's not like we're cheating and taking an extra one when other people didn't get it. Everybody's going to need 3 shots. Otherwise, everybody's immunity is going to run out at 7 or 8 months, and we're going to be vaccinating the world again everywhere with the 3rd shot, and that's going to be a real horror show. So get ready to deliver by 3. Get your immunity going, say, for 2 or 3 years, and then we'll see if you need to do it again.
Okay, well, that all makes sense, and I don't know. I was about to say I agree, but how can I argue with you? All right, so are we done with boosters? Yeah,
I'm boosted out. That's
okay. Boosted. Let's talk about passports. Where are we? Where are they being implemented effectively? We've talked about this before, but I think it matters to see where in practice it's been effective, and would that work across the board in this country or others? Cities, locally, what?
Canada, by the way, got a passport. A lot of Europe now getting vaccine passports. Greece, for example, they want tourists. They want to see your vaccine passport. Big disappointment with the Biden administration. Did not put in international vaccine passports. I don't know why. It's like radioactive to those guys. They won't do it. They think they're going to get too much pushback. But at a minimum, you have to have a passport. We've got to put it in to travel internationally. I'm at NYU. I got students coming in from all over the world. People want to see their vaccine passport before we let them in. It's just a condition of international travel, and it's nuts. How's that for a technical, ethical term? Nuts that we don't have international vaccine cards with a chip in them that you can't counterfeit, that you just show that you got the vaccine. Domestically, I favor it too. I mean, I'm sick of watching people wander into bars and restaurants and they have something that they, made like in kindergarten, cut out on orange colored paper, say, this is my vaccine thing. I got a vaccine. I mean, they're counterfeiting all over the place. It's stupid. And people say to me, well, for one thing, I sure don't want anybody to know my vaccine status. Really? And you're telling me that with your cell phone in your hand, so they know every purchase you've ever made in your life. You're going to tell me, well, you know my point. You sold out your privacy like 10 years ago. Mark Zuckerberg knows everywhere you've been, everywhere you bought something, everywhere you go. He even knows what Russian bot is likely to influence you. This idea that, oh, well, I wouldn't want somebody to know my vaccine status. So, yeah, we need vaccine passports like yesterday. Why we don't have them, I don't understand.
Because, sir, not all of us support your type of tyranny that you want to impose.
There you go.
Americans. I, for one, am for liberty and freedom. Apparently, you are not, which is really surprising given your
and your next move is to show me your gold star.
Well, if you don't mind.
So, by the way, folks.
By the way, it doesn't mean what it used to mean or whatever. I don't know.
So, look. It's not tyranny. It's basic public health common sense. We want to know that you're vaccinated before you come in and expose me, before you come in and expose my kid who still couldn't be vaccinated. It's a reward. You get to go places, concerts, Broadway shows, I don't know, sporting events, dining out with Pete. I mean, it's like this is your prize. And the idea that there's some tyranny against you because somebody knows your vaccine status, what are they going to do? Come up and take off their mask around? I mean, what's the penalty?
Well, speaking of just, kind of a maybe a historical, I just want to get your take on this. we're not hearing as much. I mean, there have been people talking about gold stars. Unfortunately, we're not even joking. But I think what we hear a lot is segregation or medical apartheid, and I find those terms reprehensible. So I did just want to get your take on language, and because we should reserve certain types of rhetoric and words for history and where they took place and give them the respect they deserve. This is not one of those.
I agree. That's why, I started off ranting about boosters and said, no, they're not boosters. They're third shots. Then you feel better about taking your third shot than you would about stealing a booster. Words matter. The gold star thing is completely repugnant. People clearly were marked with the stars. They're going to go kill them. I don't think we're going to go kill you because you're vaccinated or you didn't vaccinate. It's an absurd.
No, but you might kill us.
Pardon me?
No, but they might kill us.
They might kill us. Well, that's true. But in any event, no one's going to round you up according to your vaccine status, send you to a camp and kill you and throw you in an oven. I don't think that's the proper analogy. And as you said, it's not apartheid. All we're trying to say is in society, when you get vaccinated and you want to go places, you should be able to show that you did it. Here's something. Go to the airport and tell them, I don't want to show you my ID. I don't need to use any identification. I just want to get on these planes and go where I want to go. And by the way, I'm not going through TSA either. What are we talking about? I mean, really, I think on Amtrak, I had to show ID to ride the stupid, ridiculous train. So vaccine passport, I don't see the horror of it all.
I mean, it's almost more basic than that, and people talk about the U.S. Constitution or freedom or liberty, but the general principle of humanity has seemingly always been: if you live in this house, if you work in this place, if you come to this church, if you go to this game, there are an agreed upon set of rules, and if you don't agree to them, then you don't get to be part of this house, et cetera, and so on. That's not American or anti-American or anything. It's a sense of, I don't know. You could take it.
Here's another word I hate. I oppose those vaccine passports or vaccine mandates. And you know why? Because I'm a patriot. Really? So your patriotism is you're going to kill others. Your patriotism is that you're too much a wimp to take a simple, safe, and effective vaccine. Your patriotism is you're going to believe phony malarkey on the internet, QAnon type theories. I mean, how did they get to capture the patriot side of this?
Well, I have a better example of that, which is to another question I was going to ask you, which is about specifically school mandates. So we've seen the governor of California in the state of California put them in effect, and I think New York State, is it statewide? Certainly New York City, everybody has to be vaccinated. The teachers, there was some controversy there, but the governor of West Virginia, who has been every day going on TV and begging people, bringing his dumb dog on and telling them to get vaccinated. And he's got this folksy, likable attitude. And yet he said on TV the other day to a reporter asking him about mandates for schools, he said, come on. He said, this is America. And she said, what's the difference between this mandated vaccine and the other 13? What's the difference? So how do you take that one, Dr. Caplan? This is America, and people.
And this is America, and we like living children. It's a position we take, and we're much in favor of it, and we think it's good. I agree. We've had, I think you're probably right, it's roughly 13 mandatory vaccinations before school entry. It's gotten rid of measles. It got rid of mumps. It got rid of whooping cough. It got rid of a zillion other diseases, polio. Why wouldn't COVID be on that list? It should be on that list yesterday. The only problem is we don't have the data in yet to say, it's safe and effective. I'm expecting that data within a couple of weeks. And of course it should be on the kids' mandatory vaccination thing. One place, the reason we have school mandated vaccines is because schools have been a place where you spread disease. And that's what will happen with COVID. If you don't vaccinate them, they'll go to school. Yeah. Sorry, Gov.
Yeah. Let's talk about the airlines. United Airlines, I think, was first to mandate vaccines for all their employees, right? Is it passengers too? And then also, was it Delta that had a kind of a stick approach where they said, listen, you can still work here, but we're going to dock your pay and make you pay more insurance.
Southwest just announced the same thing.
Okay. So
employee oriented. I think that's great. I think it works. United said about 0.01% of the workforce did not comply. By the way, mandate critics, and I've been screaming for mandates, I think, since about 1954 on this issue, but they work. Everybody's putting, I keep seeing these headlines. Well, Colorado had to fire 100 hospital
Yeah.
workers. You know what that was? 0.03% of the
I
workforce.
know the headlines have been terrible headlines. It's like 17 workers quit. Like, good luck.
Who cares?
So what?
And here's another question just on that point before we come back to airlines. If you don't measure it against your last 17 people who wouldn't vaccinate, the question is how many people did you lose because they had COVID? I want that number vis-a-vis who didn't vaccinate. I don't care what the 17 knuckleheads did. If the 35 were out due to COVID, I think that tells you something. So I think everybody who walks on a plane should be vaccinated. I don't want to sit next to some yo-yo for 7 hours going to California or someplace. The air circulation on planes is highly good. It's excellent. It's really just the freshest air you can. I'm kidding. It's like you're in a cylinder. You might as well fly out there in an MRI machine. And I mean, come on.
It's not that bad. I mean, make yourself less.
So, yeah, why wouldn't we again say no vax, no flight? By the way, could this be extended to cruise ships, perhaps? Like, how many outbreaks did we have there?
Well, the issue there is it could probably be about just spreading the virus to a region it's not in as well, right?
Absolutely.
I mean, travel.
Same is true on domestic flights. You're moving the virus around, allowing that. And I know they try to get people to mask, but you know this and I know this. When you walk down the aisle on a plane and you see how people are wearing their masks, many of them seem to think that their nose is on their hand. I mean, the mask is not on their head. It's like not even close.
Yeah. It's like watching people ride a bike with their helmet on their handlebars.
Exactly.
Why have it? Why are you carrying the safety device? Just put it on your face and head.
Exactly. A friend of mine told me he thought it was the greatest development in fashion statements, where you put your mask.
What about people wearing masks in their car alone? Am I allowed to judge them?
Yes. I think that's silly.
I have listeners who legit are like, you're offending me. You're annoying me a little bit. I'm like, all right, I'm sorry.
Well, look, I mean, there has to be some room for, like carrying caution and craziness over the edge. I think if you're driving alone in your own car, no one's been in there recently, probably don't need the mask.
Well, what if you touch your hand to your face?
And if you touch your hand to your face, you probably need a cup of coffee because you're falling asleep. But no, I mean, let's not go completely out of our marbles. Although it is a good question about this. Should you mask even if COVID went down because of the flu? Are we going to see more people say when they're out,
yeah,
put down that mask? And I think you're going to see some of it. I don't know if it's going to be Japan or Korea where people mask routinely outside, but I think you're going to see more of it.
I think it sounds like a pretty good idea.
It's hard to argue against it.
Yeah.
There are other respiratory things besides the flu, colds and other stuff,
Let's talk about just the first frontline workers and specifically, physicians, nurses, healthcare workers. I guess the most troubling statistic is those who are, have degrees, who are educated, who are falling for myths or disinformation, and they're in the healthcare field and they're not getting vaccinated. That's one thing to discuss. And the other thing that I really want to ask you about is I talk to a lot of physicians because I am a sophisticated person and I want to believe. That's what I want to tell people. And I am hearing the same anecdote over and over. The burnout is crazy. And specifically what they're complaining about is, listen, I'm sick of putting myself at risk to save you from something that could have been easily prevented. I can't do that anymore. Doctors, physicians, nurses, they're quitting as a result of this. It looks like an actual terrible trend. Specialists who still aren't able to do the procedures that they're elective procedures that they're paid to do are also quitting. And finally, there's beds being filled up, overflowing. We're there. We are. I remember you warning us about this horrible thing. We saw it in other countries. It is here in many states. It is horrific, and I don't I don't want these people to get a bed over somebody else, frankly.
Yeah.
So maybe I'm a bad person. Take any of those you want.
Well, you're a sophisticated bad person.
Yes.
So that's good. All right, the front end. Healthcare workers who won't get vaccinated, I have no time for that, no interest. They should be ex-healthcare workers. End of story. I don't care. Fired by, you can't follow the science. You can't follow medical recommendations. And by the way, everybody we're listening to now on the healthcare worker side who says, I don't want to be vaccinated, they had to get a flu shot because I pushed that mandate through 6 years ago. So what are you talking about? You'll take the flu shot, but you won't take this shot, which has more data, works better. I'm not sure it's safer, but it's a hell of a lot more effective than the flu shot, which works somewhat, but not great. And I know a bunch of people. Here's the question. Take your story and sort of turn it around into a real world thing. A lot of family docs, primary care docs have said to me, do I have to take people who are not vaccinated in my practice? Do I have to see them? I don't want them in my office. I'm afraid they're going to infect me or my staff or people in the waiting room. And I think they have the right to do that. I think they can say this is a vaccine only family medicine practice or OB practice or pediatric practice. And if you don't vaccinate, you won't follow my recommendations, my requirements, or mask for that matter. I can't work with you. Go find somebody else.
Do you think that it's fair to create a law for hospitals or physician's office, or it should be up to the hospital?
Well, to get to the hospital setting, we do have a law, and I don't think we should change it. That law says if you crawl into the emergency room, they're supposed to take care of you.
Right.
And I think you got a hold of that. So whether it's COVID or drinking or drunk driving or whatever, didn't wear a helmet, okay, but stabilize them in the ER. But then sometimes COVID comes in this way, Pete. I can predict the person with COVID is not going to do as well recovering as the person who, let's say, had an asthma attack or a heart attack. Does it matter then? Yeah. So sometimes if you're in there because of COVID, you may get the bed, but you're not staying in it as long as the other guy if we're jammed, because it's going to make you less likely to survive.
The vast majority of people who come into the hospital or the ER for any reason are not endangering the other people in the hospital. The vast majority of people aren't contagious. And when they are, and they have maybe some kind of either rare disease they got overseas or something that's unidentified, there wasn't the excuse generally of a vaccine. Everybody knows you can't not know that this is available. And so this does seem different to me than a gunshot wound or someone who, ate too much or quote, didn't take personal responsibility, whatever. It's their fault. They're unhealthy. There was a smoker, whatever it is. This seems different, but you're telling me it's not. You got to take them in.
I think you still got to take them in. I think, for example, I don't want to figure out if this guy didn't get a shot because he's dumb and he didn't realize it was out there, or she couldn't get there because she had 3 jobs and 9 kids and couldn't get to the shots, blah, blah, blah. I don't want to sort that out. I'll just take them in. But then I'm going to start to figure out whether it makes a difference. By the way, if we did exclude all the centers, we would at least solve the healthcare cost problem, because the whole damn hospital would just have 3 Mormon elders and a nun in there.
All right. Well, what about the doctors who are knowingly giving out, like excuses? What about this doctor in Kansas you were telling me about?
So there's a senator from Kansas, a senator, the guy, former OB/GYN guy, keeps saying, well, we don't need shots because we have natural immunity. And when you have natural immunity, you got infected, you don't need a shot. So 2 things about that. 1, not true. Not everybody got exposed to the same dose from having COVID exposure that you do when you get the vaccine. So the vaccine works reliably. And as we said at the start of our discussion today, or seminar or class or whatever we're in, you're going to need another shot pretty soon. So don't tell people they have natural immunity and they don't need shots. They're all going to need more. All of us are going to need a second or a third shot. I think this guy ought to be condemned by the AMA. I think his license, if he still has it, ought to be suspended. You can't go out there and give people BS when we're in the middle of a plague still. It really bothers me because, look, the way Congress works, and you probably know this better than I do, Pete, but they defer to people who have different expertise. You come in and you say, I'm an engineer. They say, well, what about infrastructure? This guy, they say, well, you're the doctor. What do you think? He plays a very influential role, as sadly does Rand Paul, who's also doctor from some planet. And they get listened to. And when they blather on with nonsense, it really harms people.
All right, I'll let you go. Got a million more questions as always. Is there anything else that we missed that you think is super relevant that you want to mention that you're covering that maybe outside COVID? I mean, remember back in the day when we used to do this and we'd go through a whole bunch of other bioethics?
That's true. There were other things going on. Well, I'll tell you one thing that is flitting around that's going to prove to be interesting, and that is, let's watch the Theranos case and that lady, Elizabeth Holmes, who's sort of on trial for touting false technology. Her argument is, how can I be blamed? I just believed what people told me. And my argument is, you're the CEO of the company. Are you kidding me? If that woman doesn't wind up cracking rocks in some federal penitentiary, it ain't a good outcome. But let's keep an eye on that because
it sets a precedent.
Yeah, and it's corporate medicine at its best. All our Silicon Valley investors want to get in on the cool thing.
Hey, what do you make of how do you generally take the claim, the argument that people say, big pharma is evil and they, if even without getting into conspiracies, they're making all this money off of all these drugs? Because I can criticize big pharma all day, but I can also say they have developed drugs and treatments that have saved and made life better for generations now. So, but how do you
they're mixed bag for me. They have come up with many things, curing hepatitis, got rid of polio, done well in trying to fight COVID with vaccines fast. They just charge us too much. And the American medical approach, which we continue to operate as a free market for healthcare, it makes no sense. It is absolutely irrational. We'll come back and talk about this again in the future. But look, if I say to you, I'm going to let the companies who sell you drugs kind of negotiate the price that they want. And these drugs might actually prevent disability or save your life. So what are you going to pay? I mean, are you kidding me? So they can gouge us and they can overpromise us. And one of my favorite things these days is direct-to-consumer drug ads. Yeah. Remember to remind your doctor if you have diabetes or hypertension not to use this. Remind your doctor? What kind of doctor do you have? He doesn't know if you have diabetes. I mean, these ads are completely out of control. You don't advertise to patients, name brand drugs, that sort of. So many sins. Yes, many cures, but boy, the fact that we just trudge on in this kind of, it's a free market. And, if you don't have the money, you don't get health care. And if you have a little money, you get bad health care. And then we'll just advertise these drugs to you because didn't some of you look on the internet and aren't you ready to make decisions about what's the best thing?
I do my own research.
Isn't that on a tombstone somewhere?
By the way, when I say I do my own research, it generally is in reference. What I do, I've always done this, by the way. I don't want to spend hours trying to find out the best, most affordable camera. I'll just ask someone who did all that work. And when it comes to medicine, I don't know how to read a study, much less an abstract. So I'm going to ask a person who does, and I might ask a few people, but they're all going to have like years and years of experience looking at research and outcomes. This, the idea that we don't just generally defer to experts, a few experts, that we do it on our own is bizarre. We don't do.
You do think though that people who take their last science course in the 8th grade would be in a position to do their own research in the medical science area?
The people. My daughter's in 8th grade and they don't remember what they learned yesterday, and neither did we, because you're not that interested.
Right. And you don't use it until
I mean, come on.
25 years later.
Yeah, it's preposterous. Thank you as always.
All right, this is great.
To have you, sir.
Thank you for having me.